Hi, welcome back. So this video we're going to be talking about typical diagnoses and words that are more medical language that could be scary to hear from your doctors. So a lot of the times we're told all of these things that are wrong are found on imaging, or just the doctor will diagnose you with something, and not understanding that can cause a lot of fear, which causes you to avoid doing activities you may like. So here's a table that I found that I really like to describe these. So we're just going to go through these very quickly. So first one is chronic degenerative changes. This is just normal changing. So if you see this on an MRI or an X-ray, just know that this is, everybody has this. Imaging findings aren't always what's the cause of your pain. There's patients who have this. Everybody probably over the age of 12 has chronic degenerative changes. It's just part of the normal aging process because we're using our tissues. Negative test results, that just means everything appears normal. So typically you do want to be negative for test results. So that can also sound scary because negative has a negative connotation. Instability. Instability is also a very fearful word that sometimes we do use in PT, and that just means that you need more strength in order to control your body better. That doesn't mean that you're broken. It just means that we could strengthen you to be able to feel like you have more capability to perform an activity. Wear and tear is another thing to describe normal age changes. Let's see, bone on bone is something that is often used for osteoarthritis. It just means a narrowing or tightening. Arthritis is not an end-all be-all diagnosis. Sure, it can cause pain and other symptoms, but that doesn't mean that we can't give you ways to cope with that, ways to strengthen your muscles around it to offset stress placed on those joints. Again, that's not something to be fearful of. Paresthesia just means an altered sensation. It's generally neurological, so maybe feeling tingling, pins and needles, something like that. Can be caused by many things. It's, again, we can give you ways to adapt to that. It doesn't mean that you're broken. A trapped nerve. A lot of the times there's this thing called neural tension where your nerves can get shortened just like your muscles can. And in those cases, we can give you exercises in order to stretch the muscles out, or stretch the nerves out, sorry. And this isn't, again, an end-all be-all, you're broken forever. It is very sensitizing and might take a while, but it is possible to help with that. Lordosis and kyphosis are just describing normal curves in your back. Again, nothing to be fearful of. Lordosis is when you're curving inward, so think of your lower back, and kyphosis is when you're curving outward like this, so think of your upper back. A bulge or herniation. A lot of the times you'll hear that you have a herniated disc or a bulged disc. One thing to keep in mind is radiology, so x-rays and MRIs are generally taken in a static position, so you're sitting still while the image is being taken, generally in a pretty awkward position. It's not showing us how you're moving dynamically. So it's hard to tell if this herniation is actually the cause of your symptoms. And sure, it can push on a nerve and stuff, but it's not something that's can't be helped, or we probably can't fix it altogether, but that one position might just be the only place you feel the herniation. There's ways that we can help adapt to this. Let's see, effusion means swelling, so just an area that has some more swelling around it, an area that's just a little irritated. All is well there. Chronic conditions typically mean it's just been there. That just means it's been there longer than 30 days. You've been experiencing it longer than 30 days. Does not mean that you can't get over it or overcome it. That's something to keep in mind, that we can work on it. And then finally, you're going to have to live with this. Again, very fear-inducing. just means you might have to make some adjustments to your life. Nothing, we can always work on that. We can work on changing your lifestyle and incorporating more exercise, or being careful when you're doing things but not stopping things altogether. Well, hopefully this helps you guys feel a little bit better about something that a medical professional may tell you in the future or have in the past, and that these are all just fear-inducing words that we don't think about because we know what they mean and we don't understand that other people don't.